Great. Good evening, everyone, and welcome to today's webinar. My name is Sophia. I manage and organize Spectrum events for you, bringing the community together through learning at Spectrum. So for those of you who are new to Spectrum, aside from organizing webinars, we touch on current affairs and also future-looking ones. We run physical events and offer workspaces for the community experience at our beautiful space at Duo Tower. So we bring together members and provide the connections to expand your business. So today's webinar is on future cities, work and life after COVID-19. So Spectrum is privileged to have these panelists and moderator with us this evening. So first up, I have Atsushi Taira. He is the Managing Director of Mistletoe Singapore. He has 30 years experience in the tech and consumer industry in a variety of roles in Accenture, Coca-Cola, Richmond Group, and American Online. So Mistletoe, as a collective impact company, has a mission to recreate a sustainable human-centered future using technology. Atsushi's perspective from working with a community of entrepreneurs, investors, researchers, and visionaries to solve global social challenges will provide a great perspective on this panel session. So through our partnership with Healthcare FinTech Alliance, we are also privileged to have Dr. Raymond Ong on this panel session. So Dr. Ong is a medical director of MHC Asia Group. He is an experienced A&E clinician, currently fronting the Mount Alvernia 24-hour outpatient department. So he's also the co-founder of Better Health, a telemedicine platform in Singapore. So he will share the trends and more about telemedicine as Singapore's Smart Nation initiative. Next up, I have Gerard Teo. Gerard is the Chief Technology Officer of IDA Technology. His work is inclined towards application of parametric and optimization methods towards architectural design. He runs the innovation and virtual reality department in the company. So his foremost perspective on how future of building design and architecture in Singapore will look like at this panel session. Last but never the least, we have Pooja Gurbani. She is the partner with Golden Equator Ventures. Pooja joined Golden Equator Ventures with more than 2 decades of experience managing different types of investments across London, New York, Hong Kong, and Singapore. So she mentors portfolio companies and maintains strategic partnerships across the innovation and investment communities. So who best to moderate this session with a wealth of knowledge on today's panel discussion? Before I hand this over to Pooja, audience, if you have any questions, please post it on the Q&A window here. So over to you, Pooja. Thank you.
Thank you, Sophia. COVID-19 has brought major changes in the way we live and work, accelerating the adoption of emerging trends such as flexible remote working, the utilization of remote smart health solutions, and others. Many see this acceleration as a positive shift that will benefit us all in the long term. These changes will also impact many other aspects of our lives, from urban planning to workspaces and mental health, for example. I'm going to now turn to our panel that are at the forefront of driving change in various industries for their views and predictions on what our everyday lives will look like during and in the post-COVID future. Post the circuit breaker, Singapore has reached phase 2 of its reopening. Despite this, the government is encouraging people to work and stay at home when possible. Panelists, how have these measures impacted you and your areas of expertise? I will turn to Atsushi first for your views. Atsushi, I think you're on mute.
Now, can you hear me? Okay.
Yes, now we can hear.
Yeah, so actually we are supporting startup and also investment globally. So from the beginning, actually, we have been working remotely, of course, physically here in Singapore. So in that sense, I think not big difference, but we have more online events, online meetup, right? More and more, almost every, week or, twice a week. And then I realized that some participants mentioned that, wow, online makes us more closer. Because, if it is in New York, right, I say, okay, next time, the next time will be, I think, 6 months later, or my neighbor happened, right? But now, even New York or Europe, wherever, okay, let's have a online meeting, right? In that case, wow, we have more meetings and more, I think, closer feels like, even though physically quite distance. And also, I think, usually, offline, online mixed event, online side is actually left behind. So offline is, is a chatting each other, but online side, I think, could not do anything. But now everybody's the same, right? It's kind of equalizer. So regardless of the place, either countryside or urban city, the same. So then I think quite interesting because it's no benefit or disadvantage of the places anymore. So it's, of course, a lot of a disadvantage because of the online only could not feel, as a human, but the other side, it could be an equalizer, and it can be quite flat, situation. Yeah, thank you.
Interesting. Now I will turn to Gerard.
Yeah, so I think how we've been affected, like everyone else. So now remote working has become the norm. The main impact to us is really how we communicate, because traditionally we have these set of information, these drawings, plans, sections, elevations, which we go through with the clients and the other consultants on a project. So now the challenge is how do we communicate that digitally? So for us, digital communications is already halfway there. We actually have a lot of our information in digital form already. So since 2009, we've been doing our submissions digitally to the authorities, such as the Building and Construction Authority, URA, and the rest of the Singapore authorities. But what we really need now and how we use it is interface into this digital technology. So how do we communicate this, over the air? How do we show them, okay, this is the actual 3D model that we are talking about, rather than pulling up the drawings, because we're not able to do things like, sketch it out on the drawings for them. So we've been really looking at new interfaces, things like live digital walkthroughs, virtual reality coordination sessions, and things like that. So compared to like what we're having now, online conference where we can see the other party and we can, gauge their reactions, for us, it's really more important to start looking into this digital information. So when we have a 3D model, we can start looking at, a specific detail within it and discuss how to resolve any issues that is in there. Yep.
Oh, that's very futuristic.
Yeah.
Dr. Raymond, can we hear more about the medical industry?
And definitely.
You're on mute.
So definitely, I think for the medical industry, this is one of the areas where it has affected us quite a bit. Generally, even during phase one, we were already practicing, but the mode of practicing and what we can practice is, of course, not complete. So things like aesthetic medicine, chronic medicine delivery, all that couldn't be done. So we actually are in the process of actually also coming to terms with the new technology and how are we able to actually leverage on all this digital platform to be able to deliver healthcare to our patients who do need them. So definitely it's affected us quite a lot. And I don't know how many Zoom meetings in the past 2 months or so. Yeah, that's also affected the way we do office work as well. So definitely all of us are in the same boat here. Yeah.
Okay. Let me go to the second topic because it'll follow on from what we just discussed. Tech are in no rush to bring employees back to offices. CEOs like Facebook's Mark Zuckerberg have also announced that as much as 50% of its workforce could be working remotely in the next 5 to 10 years. With remote working or working from home becoming a work culture and on the rise, Gerard, perhaps you can enlighten us on how this will change the future of building design and architecture in Singapore. Are physical offices here to stay? And how do we make working from home more comfortable?
Mm-hmm. So, okay, definitely the immediate reaction to this is to retrofit all our existing offices. So you see a lot of works going around about, segregating offices and I think this is especially challenging because a lot of these were designed to be open plan offices that encourage interactions. So now you have things like these fabricated acrylic screens that screen people off, and you have physical separation. But I think what's interesting here in the working environment is we've always used digital designs as a means towards a physical manifestation of that office. But now there is more value to the digital design and in the way that we experience it. So people can actually come in and log into a digital office and interact with that with other people in that environment. So rather than being the means to the end, it can be the product itself, digitally designed office. So I think some example of this is how much value this has. So for example, somebody modeling this high-end office space, which is a loft, has great views. If you were to lease out the physical space, it would be something like tens of thousands of dollars a month. But now that you can experience that, how much would you charge for people to come into this digital space, and how would we start to design these spaces which are not just the middle step to get to actual physical construction?
So would you say this has already posed a lot of differences in your industry and what clients are looking for?
Yeah, definitely. I think it's not quite what the clients are looking at yet, because we probably are still one step away from really embracing the whole remote working ideology. Currently, yeah, as I mentioned, it's working with the current spaces we have. How do we retrofit them? How do we comply with all these regulations that are being imposed? But as we step away from that, the next step is probably, okay, how do we create optimal digital environments for people to work in?
Okay, maybe Atsushi, could you also share with us what you're envisioning with changes in urban planning and other real estate trends globally? What would the relevance of a CBD still be in the future?
Yeah,
Atsushi?
so yeah. Actually, if you look at the current city design, everywhere in the world, Tokyo, San Francisco, Singapore, it's all based upon centralization, right? Because that was, maybe last 100 years, it has been the same design. Cars and roads and buildings are center of the design, because that was the kind of norm, right? People need to get together physically and need to work together. Somehow, we believe that will continue forever, right? However, this happened eventually, and then we could not imagine, is it possible to work remotely? Because this discussion has been continuing a long time, right, before COVID. Either, better to be more remote work, or not possible because we need to meet together. But we are forced to do that. Then eventually we realize, it could be possible. Of course, manufacturing, some, of course, work could not be done. But if it is a desk work and also design work, things like that, wow, it is possible. That's why I think it potentially could be fundamental change from centralized design to decentralized, right? Of course, it's not happening yet, but we believe it could be better because the land price will be more neutralized, because if it is decentralized, it's not, we don't think, it's center is a high price, it's the suburb is a low price, right? But if it's a decentralized, more flattened, and also more less density, and then more maybe healthier mentally, and also don't need to, especially Tokyo, like a big metropolitan, commuting time is sometimes 1 hour or 2 hours, crazy. But don't need to do that. Maybe more productive, and then being together with family. So I think, of course, at this moment forced, but we take this opportunity positively. I think we can change the design completely more decentralized. And in that case, the CBD will be maybe taking a different role, like maybe good for more entertainment sector, or maybe for green, or maybe even farming. That will be the next role. And then more like a get together to maybe enjoy rather than just working. So I think it's a very good chance, but of course, depend on the country, depend on the culture, of course, taking different way, but it could happen. And also eventually, if you look at Tokyo as well, I had the news that, some big corporation, maybe 100 years of the big corporation decided to reduce the Tokyo office and maybe half and one third within, 1 year, 2 years, and then building the satellite office rather than, centralized office, so that, people outside of Tokyo can work, nearby, and then decentralized way. So it is already happening. So I think that will be the interesting things.
Would you also say that would be more impactful, because that if there's less commuting, it's better for the environment, and in essence, it's much better. There's no emissions, no use of gas.
Right, yeah, because I think cars could be risk prioritized, and then also together with the autonomous cars, right? That is happening. Within maybe a few years, cars could be mainly autonomous. So in that case, people are not driving. In that case, maybe no high priority car itself, versus currently cars are king, right? They occupy the parking slot and big space on the road. But if we're taking out the parking and also big road, a lot of spaces available for people, humans. And then, I think Singapore can move faster toward that direction, make city more, better for the humans and also humanity. Yeah.
Okay, and to follow up on that, if the use of the CBD changes, do you think that would be a different valuation of a CBD in the future? Because if it's more of not an office space, but more of a leisure space, do you think the values of CBDs will change in terms of valuations?
I think equalized, right? So
more
decentralized mean that, more equalized. But maybe a good idea to set up, a theater or a big park, for the people to get to. Of course, at this moment, we cannot get together. And it should be less than 5. But I'm talking about the phase 3. It could be possible, right?
Okay, let's turn to technology as an enabler. Technology has allowed us to work, study, shop, and socialize and be entertained remotely. Even more importantly, it is also allowing us to be cared for remotely. Turning to Dr. Raymond, during this time, is it apt for patients to consult a doctor without having to leave their homes and have their medicines delivered to their doorstep? How much has this trend taken on? Have you seen a spike for telehealth during this time?
So we definitely have seen a spike in telehealth so far. The big reason is also because of a necessity. We phase 1 around, patients were not allowed to actually consult doctors for their chronic medications. So they had to get around the idea of actually seeing a doctor remotely and getting their resupply of chronic medicine via telehealth. So that's one of the big pushes. And with this, patients are starting to actually come to realize and accept that actually a telehealth consult versus that of a real consult, physical consult, is not that much difference when depending on the condition and the case. So for example, on your regular kind of chronic medicine top up, right, you realize that actually a lot of the values we ask for, vital signs recording, blood pressure measurements, all can be done at home on your own, and you inform us about it, as compared to a once-off doctor's reading, which is actually not really very relevant to blood pressure maintenance and control, because it's supposed to be a trend, not just a once-off reading. Also, your very common conditions like your cough, cold, runny nose, your vomiting, diarrhea, these kind of simple acute presentations are also very accessible via telemedicine. We more or less, based on history, will be able to make a quite a sound diagnosis as well. So I think the fact is that even before the COVID crisis, telemedicine as an industry, as a way of practicing medicine, has been coming to play. And this is when people are actually exposed to this new way of doing things. And they're safe, and they realize that actually it's okay as well, which is same as your meetings. People are realizing that it's actually fine to have a virtual meeting, and the work mostly gets done as well. So I think it depends on the context, depends on the severity of the disease as well. Same thing for any meetings. Yeah.
So you see clients, they're comfortable with this. They're okay contacting doctors remotely and explaining symptoms. How does it work? Maybe you can explain that to us.
I think generally, when we first see a patient, there might be some things that are not done. For example, you will not get your usual auscultation. Doctor won't pat you on the tummy for a few times. But after that, we realize that with the consult, the diagnosis, the medicine is actually the same as your physical consult. And then when you take the medicine, you feel better and you realize, okay, fine, this actually works, and I'm okay with that. So of course, there's some hesitancy at the start, but generally, once you have done it a couple of times and you realize that it's kind of the same, then they actually become comfortable with this mode of care. Of course, when we are doing a teleconsult, we do explain the entire process. We do come to a conclusion of the diagnosis. We explain how we arrive at that, and we explain how the medicine that we are giving is going to be helping each and every one of the symptoms. So there is a bit of sort of a walkthrough in a sense, so that the patient feels comfortable with this mode of delivery as well. Yeah.
Interesting. Interesting. Maybe we'll turn to Atsuchi. COVID times more productive.
I'd like to capitalize on the Dr. Raymond comment. I think preventive healthcare will be becoming bigger. Of course, even healthcare system will be digitally and remotely. And then if we utilize sensor technologies and also other, digital technologies, we can get more data continuously. And then it is possible to predict, some diseases or symptoms, before it happens. So, and then earlier, we find, and then of course, it's better to cure quickly. So, for example, we have one investment in India. So India is actually healthcare-wise very left behind. But because of that, one startup is trying to provide a kind of public health, diagnosis, not inside the hospital, but at the station or, in the mall, quick checkup, like, blood testing and also blood pressure and also body composition. That's quite amazing because people can check, the body health condition easily. So don't need to book, just stop by and then quickly check and then, analyze on the crowd by AI and then get some report. So we are more frequently get some checkup, at this one, most of people only once in a year, right? But if we have more frequent checkup and then it could be better, so that's why it's a remote, but not perfect, but it's maybe good for early, diagnosis, right, purpose. And also, healthcare is a big, the portion of the impact, but also, obviously for working, like we have a lot of technology, it's a virtual presence, using a VR, AR, or MR technology, of course, that Gerald knows more, but that's it's advancing. So even we can meet, virtually, from around the world, then they can talk and then can see avatar. Then, we feel like almost we are meeting together. Of course, we could not drink and eat. That's a downside, but it is also possible. And also maybe AI will play a big role. One of the startups in Silicon Valley we have, it's kind of personal assistant AI. It's basically AI seeing the emails and also my calendar and then support me. Okay, it's better to contact somebody because you got this email, but I forget, right? So if it is a physically we work together, we have more chance to maybe understand what's going on. But if it's totally remotely, maybe some AI or assistant AI will fill the gap. So that kind of new technology can be also maybe interesting. And then actually the startup called the Module Q is now on the Microsoft team. Microsoft team is that they like a communication tool, and then basically a chatbot will be there, and then suggest something. It's better to check this information, better to contact somebody else. So that's also technology will be available. And then the other one is sort of more physical work, but kind of remote presence. I'm here, but controlling by sort of almost like a virtual reality stick, and then controlling the robot, outside of the Singapore or in Tokyo or somewhere. So it's a combination of the human and also robot and AI. And in combination, maybe you can do a much better job rather than just one side only. So there are a lot of technology will be available and quite interesting.
Gerard, are there any new technologies being created to support the design and architecture of spaces in the future?
Yeah, okay, definitely. Maybe I'll start from a bit older to newer. So I think back in the 60s, there were certain groups such as Archigram who really started visualizing the city of the future. And one of the consistent themes was, of this modular city, of this plug-in city. So I think we are quite headed towards that in terms of now the technology we have in construction. So things like prefabrication, especially PPVC, which is prefabricated, pre-finished volumetric construction, which is literally like Lego blocks, which we crane into place and assemble the whole building really quickly. So currently all our new HDB developments are using PPVC. So it allows for really fast construction. Other than that, on the design front, I think parametric and computational design is also helping us to move towards a very data-driven, evidence-based kind of design. So rather than relying on the napkin sketch, we are able to design scripts to leverage on AI to help us explore design spaces which previously we might not have been able to really start doing optimization on the spaces, to do a design by numbers where we can start to feed in parameters such as, okay, what kind of office space do we want, what kind of separation, how many people get a view, what's your proximity to maybe the water cooler, or other important parameters like that, and then start to let AI generate the space according to the parameters which we put in. Other technologies would be, like Atsushi mentioned, immersive technologies. So things like virtual reality, augmented reality, mixed reality. They are definitely very advanced now thanks to the push from different sectors such as the gaming and entertainment side. We currently have head-mounted devices which really give you the sense of immersion that you are in the space. So the big difference for this is now people are able to interact with and experience virtual spaces differently. It's no longer just a screen. When you go into VR in a virtual space, you actually have agency within the space. So it's really a combination of many small factors, like as Sushi mentioned, avatar representation. It's actually a very visceral thing, like being able to interact with someone, okay, we can, scan the person, put their face there, but just the body language, small mannerisms, you actually can tell who it is. So I think this really opens up a whole new world of interaction and the different media and data that we can interact with as well.
It sounds like challenging times brings about a lot of innovation. The world is very adjustable, I guess.
Yeah.
Let me go on to my next question. Singapore has announced the 30 by 30 plan. This essentially is Singapore's goal of 30% of all food to be homegrown by 2030. COVID has also heightened the urgent need to secure Singapore's food security. Atsushi, what new technologies and planning could enable us to achieve this goal?
Eventually, Singapore set a very good challenge goal before even COVID, right? That was set. I was actually amazed because it's quite a sort of a moonshot like a goal, right? No easy at this moment. How much? It's only maybe 1-digit percentage, right? And then reaching 30% is a big deal. But I think it's eventually it's quite important because COVID-19 actually pushed each country, try to secure, by themselves, right? And then could not rely on some other countries, right? We don't know what will happen. So that's why eventually, first of all, it's a very good target. And then, but it's not just a technology, but as combination of behavior change and also maybe policy change, and also, of course, the technology, empowered. For example, in order to reach the 30%, obviously, we need to think about the holistic view. Of course, we are talking about urban factory-based farming. Of course, that should happen. But I think that's we need to think about more like farming everywhere, like maybe community-based farming, and also maybe even household-based farming. So in combination. So I think series of the farming should happen. And then maybe in the future, it could be compulsory. Each individual need to be part of farming. Maybe 10%, 20%, don't know. But that is a possible scenario. But I think it's good because farming could be good sort of a mental effect, right? Growing something and see the green every day, it's not so bad. So that's why I'm saying that, it's not just factory-based farming, but I think it's a good idea proactively utilize, rooftop or maybe parking space or maybe wall, and then community will support, farming together. So in that sense, we can create a very good community conversation that also I think create a good sort of atmosphere, right? And also household. And then I think that's that kind of design should be necessary. That's why it's not just one agency, but maybe holistically, they should be designed. Then I think it is possible. And also need to change the behavior, right? If we eat half and then throw away, if everybody do that, even though we have urban farming, it is not possible. That's why we need to also individually need to care, like a COVID-19 fight, right? It's we take a part, right? Okay, we don't order too much, order properly, and then eat almost 100%. Try to reduce food wastage, right? So behavior change also need to kick in. So we cannot rely on one side, government or corporate. I think that people need to take charge to achieve that. So that's why it is a whole country-based exercise like a COVID-19. And then I believe Singapore is doing, even COVID-19 protection is very good, right? It's fighting with COVID very well. I think we can do that the same way for 30-30 target. That's my perspective. Hello, okay.
Pooja, you're frozen.
Oh, Pooja, oh yeah, no moving.
All right, so
it's a technology glitches.
Yeah, so I think one of the areas that we want to know as well, and maybe we can post this to Dr. Raymond, it's about vaccination. So probably, do you want to share a little bit about this?
So I think in terms of the topic on vaccination, the thing on everyone's mind is when will the vaccine come out? So I think one thing to clarify most importantly is that it's not about the amount of money or the amount of effort being put into this. The timeline will still remain the same. It's because the whole testing process involves a period of waiting after vaccination has been delivered to ensure that there are no at least medium-term side effects that is unacceptable for such vaccines that have been being rolled out. So therefore, we are still looking at minimum 1 year plus 1.5 years. So maybe probably mid of next year or late, probably third quarter of next year as well. And the other thing to point out would be that even with vaccination available, the problem here is that the efficacy and the amount of take-up is not always 100%. Generally, we're looking at about 60-70% kind of resistance rates, which might not be enough to produce that certainty and of the herd immunity that we are looking for. And lastly, of course, when we try to do mass vaccination exercises, there will definitely be a lot of resistance. So there's going to be a problem in terms of a lot of people want it sometimes, and then you have this distribution problem, and then people say only the rich people get it, and then you got some social imbalance, or the other way around. It's like some people don't want it, and then they're forced to have it to build their immunity. So it's going to create a lot of issues when the time comes when it first rolls out. So it's not a quick fix, and it will take a while. So we are in this situation for the long haul. Frankly speaking, we already have about 10 million cases at this point of time. So it's probably beyond a certain point of curve where you're able to sort of contain the disease. So all we can do is just hunker down and let it spike, and then hunker down, let it spike, until it rolls over. It's going to be there for a while, unfortunately. Yeah.
Thank you. So Pooja, where you left off, so practically the question that we brought out, I think a lot of us want to know is about vaccination,
Yes.
which Dr. Ong has shared. So I'll pass it over back to you, yeah?
Yes, sorry, it sounds like I lost my internet. It shows the challenges of these times. I wanted to, about technologies and about the 30-30 plan, I wanted actually Gerard's view about the changes in building design that could help us achieve this goal. I want to learn about rooftop farming and what Singapore has in their plans.
Right. So I think there are two main strategies. One would be, yes, rooftop farming. So I believe the SFA, the Singapore Food Agency, has just closed a tender for the rental of multi-story car parks for urban farming purposes. So that is one strategy. You convert our existing spaces into potential farming spaces. You have your HDB small farms. I think certain facilities such as Kutek Puat and the newer hospitals, they are also practicing their own self-production. So where they have where they grow their vegetables on the roof, and it's already catered for. The other strategy would be, of course, purpose-built facilities to do farming, where we would utilize certain technologies. I think there are a few companies out there such as Sky Green, which do high density vertical farming. So you have high yield farming, where you can make up for the lack of space by having these technologies and more efficient methods, such as conveyor belts that allow growing of crops in a higher density as than compared to your conventional greenhouse layout. So yeah, really constrained in a small footprint kind of thing, and of course multi-level as well.
Thank you. Let me go on to the next question. So webinars like these, this may pose a threat to physical conferences, conventions, expos, and their physical spaces in the future, or areas of expertise during and after COVID and into the future. Maybe we can talk to Dr. Raymond to kick this off.
So I think in terms of this, definitely because of it's not going to be a short thing, it's going to be a long thing, right? It will definitely affect the way we all work, and also from healthcare's perspective, it becomes for example, I think everyone has sort of accepted that influenza A is seasonal thing, and every year we get about maybe 0.2% deaths from that. So COVID probably will be that in that kind of manner for next 1 to 2 years, where we accept that there's a overall mortality of 2 to 3%, and it's seasonal, it comes and goes kind of thing. So that part for the public healthcare stays. Greater hygiene, definitely. Social distancing will probably still be around for a while, and definitely there will be a lot more resources, investments into infrastructure in terms of healthcare to provide more hospital beds, ICU facilities to be able to cope and handle all this increase in medical demand in such cases. Then, of course, it also infiltrates into all the way we work and the way we get services. I would see that delivery services, work from home services, I mean, WebEx and Zoom is going to make a lot of money. So those things are all going to change the way we actually live, play, and actually live our lives as humans as well for a long time. I mean, a few years to come at least. Yeah. And then by then, I think things will have changed a lot, really. Yeah.
Yeah, actually, at the beginning of this crisis, as a follow-on question, were a lot of medical facilities prepared for this? I mean, I believe there was a huge rush for masks and gowns and PPE. This came as a real challenge at the beginning of this crisis.
I mean, definitely to get so much N95 in as well as mask in generally would have been overkill, and we generally do not need so much ICU beds, but so it was totally unexpected. So therefore, there weren't such infrastructure at all. I mean, I think last time during the SARS crisis, the government actually has stockpiled N95 masks, and because it was kept so long, right, it actually all sort of expired in a sense, and then there was question of wastage. So it's very hard to stockpile for this kind of things because everything has a shelf life as well. So unfortunately, I guess it will be more on the terms of when you say preparing and being ready, right? It will be more on the production capacity to have in-house or uh, local capability of generating such resources or such equipment. And I think going forward, these things will all become strategic kind of commodities that there's some element of homegrown production uh, in the future as well. And that's the way we cope with such events as compared to stockpiling. Because stockpiling very, very difficult. It would just wear out after a while. Yeah.
Maybe Gerard, you can talk about threats to your industry.
Yeah, okay, maybe if I just quickly add on to that, I think infrastructure-wise is even harder to prepare for this because from what we learned from SARS, so MOHH decided that, okay, NCID would be a good project to embark on, but, you know, also in the absence of a pandemic, we cannot allow so much land space to just go and sit unused and just in preparation, so that's an even larger scale of things. Okay, yeah. In terms to practice, so yeah, I think there are threats to, yeah, you know, the norm, to the status quo, but of course these are also can be viewed as opportunities rather than threats. You know, the evolution of the roles we play in practice. If we have exhibitions and conferences as an example, we are definitely seeing some of the advantages of virtual events now. For example, now if we hold a virtual conference, attendance rates are much higher than, you know, they were pre-COVID. Pre-COVID, if you would do a virtual event, you have really low attendance unless you had a physical event. So of course, some advantages like, you know, the logistics of it, your costs such as the rental of a physical location are some things that are more immediate. We are also looking at, okay, if we are being forced into virtual events, what kind of advantages can that bring? So what is the experience of a virtual event? How much more effective can we make this rather than, you know, flying everyone over? Okay, we have this physical event. What advantages can the medium itself bring us? So in terms of architectural practice, yes, it's definitely set to change because, you know, the way we use spaces will be very different. If we just talk about social distancing, you know, everything scales up because you have to separate people. But I think more than that, it's really evolution of the role of the architect, because our primary role always has been designing space, so, and how people are going to use that space. So now, how do we design different kind of spaces that people use? So instead of, you know, this physical space that people interact with, how do we design digital spaces, digital platforms for people to interact with? What kind of interactions are they? And yeah, so I think there's that paradigm shift towards that.
Interesting. Maybe we can turn to Atsushi. I mean, you know, threats across many industries, business, travel,
Yeah.
conventions, you name it. Can you please enlighten us on your views?
Yeah, obviously, last year I think my mileage is, you know, I don't know how much, but 200,000 or something. You know, it's a quite huge mileage I got, but this year almost zero. Obviously, I think a travel industry, hospitality industry, of course, suffered a lot, right? But if we take a little bit to step back and then see the global situation, I think it's something like kind of, I shouldn't say end, but, you know, questioning about globalism. When we have been talking about globalization, globalism should be very good. And that's why, of course, Singapore is taking that also strategy, and also Japan as well. But if we rely on too much on some other countries, obviously it's quite concerning, right? And also maybe I feel like the end of the big countries like US, China, of course, very strong economically, but also fragile because they could not control their country, unfortunately. if something happened. So maybe smaller is better, that also maybe a possible way. So I think that mega trend could come. I don't know how it is faster come or not, so soon or soon. I don't know. But definitely people, all countries globally, people questioning about, is that right to rely on somebody else too much or not? At least in the question, right? At the end, okay, yeah, no problem. Or, okay, better to do by yourself. That's why I believe it's very important to think about self-sustaining, self-sufficient. And we're talking about self-propagation as well, so that we can control our lives by ourselves, at least a certain basic part. That is quite big sort of a point. And then because of that, some industry will be affected, like maybe logistics industry. At this moment, logistics industry is, of course, a massive, size because of the China to US, US to global, it's a logistics is huge, but that will be maybe reduced if all countries think about maybe local production more and then local, consumption. Obviously, logistics will be going down, right? That would happen maybe, and also, yeah, I think people don't move, right? In that case, migration, somebody is asking, immigration, maybe lesser immigration because, we can do remotely. Why we need to migrate? We can do, anything, any work globally. So maybe concept of the immigration could be changed or redefined. I don't know, tax-wise, very complicated, right? Maybe I'm doing a lot of Tokyo work and then more than 50%, and who knows? Nobody knows, right? So that's why at this moment, tax is based upon, physical presence, right? How many days in Singapore, how many days in Tokyo, right? Based upon that, tax legislation will be, defined. But in the future, it doesn't matter. And then how we can handle global tax, settlement. So a lot of things happen, right? Not just the direct industry, but all industry will be affected, I would say. Yeah.
Maybe some will change for the better too.
Hopefully. Yeah. Hopefully. And then, as I said, I think better to be smaller or, or medium size. Globalization versus more like a localization or localism or maybe regionalism will be more, mega trend, because we could not rely on somewhere far away because we could not control.
Yes. Perhaps we could turn to some questions. The first question is, how do you view the impact of changes in immigration policies in countries like Japan and Singapore? I think this is for you also, Tucci, because you just addressed some of that.
Yeah, it's a very good question, right? Because, wow, it's no physical based immigration, right? But yeah, immigration will be huge impact. Obviously, it is a physical work like, manufacturing and food, and of course, physical presence will be required. That's why it will happen. But if it is a knowledge working, I think lesser need of the immigration, right, in the future.
Okay.
Yeah. That maybe like Gerard mentioned, maybe we create a virtual Singapore, a virtual Japan, and then people actually need to log in to prove, oh, I'm working for Japan project or Singapore project, so that, tax can be settled, accordingly. That will be the future, virtual country will be set potential.
Okay, perhaps the
next... and other activities become...
Go ahead, Pooja.
Yeah, when farming, consumption, and other activities become more decentralized due to COVID, wouldn't that create a larger carbon footprint? Maybe Gerard, you could help us with this one.
Yeah, I don't think it's necessarily a larger carbon footprint, because decentralization would doesn't mean that we decrease the density. It would be different locations, but we would still maintain high density farming. So in terms of the carbon footprint, yes, it's spread over a larger geographic area, but then I think the actual consumption with the proper infrastructure and efficiencies in place should be lower than conventional farming.
Interesting.
Yeah.
Atsushi?
Yeah,
Yes,
and
yes.
also we need to think about, again, holistic view, like maybe energy-wise, we need energy, right, for farming, and we need to think about more usage of the renewable energy, right, lower carbon footprint, and that kind of innovation should happen, right, energy storage as well, and also maybe water. Water is, of course, precious here, and then farming requires a lot of water. That's why we need to think about the water recycling on the farming area. And then shouldn't use a lot of fertilizers and also pesticiding, because that's actually contaminate the country. That's why we need to think about how to prevent, some plant diseases, without using the pesticiding or fertilizers, right? So that's why, again, it's a kind of holistic view is required. Then if we do right, using renewable energy, and then of course maybe one time we need to invest certain physical infrastructure. In that case, the carbon footprint could be a little bit jumping up. But if you look at a holistic view, maybe 10 years, 20 years, long range, because of if we can utilize the energy wisely and the water wisely, and then total carbon footprint could be reduced because of that. That's why, again, it's very important to see or design holistically, time scale wise and also technology scale wise.
Okay, yeah, I'm sure there'll be some savings. There will be some increase. So it's the net effect that we have to see in terms of carbon footprint.
Yeah, and also we need to think about the logistic cost hidden inside of the food material, right? Because if we're eating now, most of the things are coming from somewhere, outside, right? We count, the cost of the logistics and also carbon footprint. At this moment, they're huge. Compared to current state of the including hidden carbon footprint, I think it could be reduced because local, production, local consumption, right?
Yes. I got one more question as a follow-up to that one. Where is Singapore with its plan for autonomous vehicles? I think this is also your area of expertise.
I think it's quite soon, right? Because it's well organized, right? It's very difficult to deploy autonomous car. We joked with one of the startup in Silicon Valley called Zoox, which very famous because Amazon announced to acquire the startup called Zoox. It's a fully autonomous level 5, no human intervention. I discussed with the founders and then asking, okay, I lived in India 3 years, and then India is very hard to drive. People don't care other traffic. And then, do you think it is possible for autonomous car to run in India like chaotic traffic? He said, almost impossible because the AI trained based in the US, for example, and then it's basically US experienced driver, and then could not drive in India, for example, right? So that's why it's quite important to be organized, road-wise, rule-wise, and people behavior-wise. And then in that case, Singapore could be fastest if Singapore won. And also Singapore government tried to reduce number of the car. So in that case, making sense to replace the car to the autonomous car. And then maybe car could be more like horse riding now. Some people, keep driving behind the wheel, but like a horse racing, horse riding, not so many people are doing that anymore. Yeah.
Interesting. So we have a question which is quite popular for the Dr. Raymond. Someone has a question on herd immunity.
I actually replied that earlier, but the fact is
Do you think herd immunity? Okay.
Yeah, so herd immunity is not like a choice. It's something that we will have to do in the sense that it's either by vaccination or by live infection. At this point of time, before the herd immunity strategy, the other way would have been a containment, where we are able to contain it to a limited amount of people and then let it burn out by itself. But at this point of time, you have 10 million people infected, so that's quite impossible. And the fact is that even when we understand the disease, right, it seems like it is having being infected with it before does not grant complete immunity. So therefore, to isolate the disease and to let the reservoir of disease die out on its own is going to be really, really, really challenging. So it's herd immunity is the only current strategy, or I mean, whether or not you want to even plan it as a strategy is just going to happen. It's not really not up to us, lah. I think the only thing that we can control is whether we do it by live infection or by vaccination. Yeah.
Okay. Okay. So we have another question. Again, I think for Gerard. Do you think physical offices will be a thing of the past?
Yeah, I think physical offices as we know it now, yes, it will be a thing of the past. Now I think we are probably, pending research agencies to see whether productivity really takes a hit. But I think in, anecdotal experience, it seems that things are still getting done, life goes on, we still manage to hit our targets. Of course, there are the immediate upsides like transportation, your daily commute. Everyone's finding telecommute a lot more convenient. But yeah, pending these numbers and justifications, I think what will slow us down is most companies' current investment into the existing offices already. Because you have leases, and then most companies are not going to shut down their physical locations overnight. But I think we will very much fine tune into what can and what cannot be done without a physical location. So when is the interaction absolutely necessary? Can we supplement that with external interactions? Or whether if you're like a production line, then yes, your physical office is absolutely essential. So we will be going down into the finer separations of these things. But I think the norm of working in an office, clocking in, sitting down at a desk, it will probably be a thing of the past. Yes.
Actually, I have a follow-on question for Chuchi for this. How does this work? If you work from home in Japan, aren't there shoeboxes?
Yeah, you have a very good point that Japan is a very tiny. Hard to imagine, right? Maybe you don't know exact space, but it's very tiny. And then I had a lot of online meeting with the Japanese folks, right? And then babies are crying, and then running around, and almost impossible sometimes to talk quietly. And that's why some of the startup actually started the sort of the startup is actually developing a smart lock cloud-based system. And then they started the sort of satellite office conversion service, which means there are a lot of space available, like hotels, industry, of course, there are almost no customers, right? And also service, hotels and also apartments, almost no customers, right? And then all vacant, for example. And then that can be converted to sort of a private office space by putting in place a sort of a smart key. And then, people can see where is available, the space, and then book it, and then go there, and then tap it, and then open, and then do something remotely. So I think, that kind of new service will be emerged. It's more like a satellite office space, or we call it a virtual private office. It's kind of, virtually private office, not actually my office, but virtually my office for a certain period of time. So I think quite interesting what things happen, especially in Japan, because it's not possible to work from home or apartment, too small.
Yeah, sorry, maybe I just add on to that. I think what's interesting is also not just, the office space. So now most office spaces are stagnant, but how people are, retrofitting their home office. You start with everything is makeshift, you have your webcam,
Yeah.
but then, yeah, people start to optimize it. Okay, what else do I need? Monitors are out of sale everywhere, out of stock everywhere, and that kind of thing.
Yeah.
So yeah.
That's quite interesting. Yeah, actually, I invest a lot of money to buy some new webcam and also new sort of equipment.
Yeah.
To make a
I mean,
better quality.
yeah, the small things like LED lights so your camera feed looks better, microphones, headsets, all these are actually the things that are out of stock. So yeah, probably that will be the new norm where everyone has a working space.
Yeah, and also I realized that every individual need to have some talent to be like a newscaster, in front of the camera, and then talk, nicely, quietly, it's sometimes not easy, right?
Yeah.
And thank God for virtual backgrounds.
Yeah.
Oh yeah, sure.
All right.
Yeah.
So I thank everyone here, the audience. Thank you, panelists, Atsushi, Gerard, Pooja, Dr. Raymond Ong, for your time this evening to join us for the webinar. Great insights here, and hopefully all of us can take back some new information and key information to take back with our companies. So if any one of you would like to reach out to the panelists, they are on LinkedIn, or you can reach out to me. So watch out for the survey link after this webinar when you exit from this webinar. And also we have another topic on Smart City, Smart Nation Initiative. Look out for it on the 23rd of July. So without further ado, thank you.
Before ending,
Sure.
can I ask one question to Raymond, the doctor?
Sure.
Yeah, because international travel
Yes.
is a big problem, right? Because like me, I travel too many times. I go overseas and meet with potential startup and to invest. And then how do you think international travel can be handled? Because COVID-19 is, of course, at this moment each country try to contain, but we need to travel,
So
right? Do you
it's
have
going to
any idea?
become much more expensive. Firstly, the means will be to actually do a local test. So we have all these green lanes of express lanes where we have mutual bilateral diplomatic agreements where we will test you here
I
and
see.
then give you a cert. And then when you reach over there, they test again to make sure they're still valid.
Twice.
And then it'll be, that's one thing that's being done. The other ones, the airlines are also coming to the idea that there need to be safe distancing even on a plane as well with mask on. So cost of travel is likely to increase. Yeah.
Where do you put your wallet? I never touch it.
I see.
Yeah.
Yeah, maybe we need to have some sort of a, space wear, and then carrying the Singapore Air or the, travel. Then coming back, in that case, maybe no problem.
Yeah.
I'm joking.
So definitely there will be a lot of things to actually work on in order to get air travel back again. Yeah.
I see. Thank you. Yeah, I'm hoping it will happen somehow, some technologies and also some, method. Yeah.
All right, thank you,
Okay.
Atsushi. Thank you, Dr.
Thank you.
Romano. So if we can keep the conversation going, so we're all available online as well. So see you again soon. Thank you very much. Have a good evening.
Thank
Stay
you.
safe and keep well.
Bye-bye.
Thank you.
Well,
Bye-bye.
Thank you. Bye.
the Puja.